What if the future of American healthcare is being rewritten behind closed doors, 1,000 pages at a time? I'm Dr. Chelsea McGee, and this is The Real 411. Today, we're talking about the Senate's latest Medicaid bill. And let me tell you, this isn't just another round of belt tightening. This is a full-on rollback, tax cuts for the rich, and a whole lot of pain for the people who can least afford it. We're talking new work requirements, caps on provider taxes, and a bill that could literally shutter hospitals. I mean, I've seen it firsthand. Medicaid funding kept a rural hospital open just long enough to save a life in my own practice. This isn't theoretical. It's happening right now, and it's dangerous. We will hear from folks on the ground, like Kevin Stansberry, a hospital CEO in Colorado, who says this bill could wipe them out. So buckle up, because the story is never just a headline. All right, let's get into the weeds. The Senate Finance Committee just dropped a 1,000-page draft of their so-called Big Beautiful Bill, and in there are some of the deepest Medicaid cuts we've seen in decades. We're talking about lowering the cap on provider taxes from 6% to 3.5% for states that expanded Medicaid. That's a huge deal. Why? Because states use those provider taxes to pull down more federal money, which they send back to the hospitals. It's not some sneaky loophole. It's how a lot of hospitals, especially in rural areas, keep the lights on. But the Senate's going even further than the House did. The House wanted to freeze new provider taxes, but the Senate wants to actually lower the cap for states that already expanded Medicaid. And then there's the work requirements. The House bill exempted patients with dependents, but the Senate, nope. Now, if you're a parent and your kid is 15 or older, you've got to work, go to school, or do community service for 80 hours a month to keep your Medicaid. That's a big shift. And let's be honest, the political motivation here is pretty clear. Make Trump-era tax cuts permanent and pay for it by slashing $1 trillion from programs like Medicaid. I might be wrong, but it sure feels like the people with the least are being asked to give up the most. And just to answer a question I keep getting, why target provider taxes? Some conservatives argue it's money laundering, that states are gaming the system to get more federal dollars. But as we discussed in a previous episode about the One Big Beautiful Bill, these so-called loopholes are often the only thing keeping hospitals afloat in low-income communities. The Senate's version is a lot tougher than the House's version, and honestly, it has hospital lobbyists in full panic mode. So, what does this all mean for hospitals, especially the ones already hanging by a thread? Let's talk about provider tax caps. More than 30 states and D.C. have provider taxes above the new 3.5% cap. If this bill passes, they'll have to cut back big time. And it's not just urban hospitals. Rural hospitals are in the crosshairs too. I want to bring in Kevin Stansberry, CEO of Lincoln Community Hospital in Colorado. He says his hospital serves an area the size of Connecticut, but with only about 2 providers per square mile. About a quarter of his patients are on Medicaid. The hospital gets around $300,000 a month provider tax reimbursements, essential just to break even. If the cap drops, he says, we'll have to start cutting services, maybe even close. And you can hear the heartbreak in his voice. If I start crying, forgive me, he said. It just breaks my heart. And I get it. I've been there. I remember a night, not that long ago, when a rural hospital in my network was about to close its ER for good. Medicaid funding, literally, the dollars from these provider taxes kept them open just long enough for us to treat a young man with a heart attack. If that hospital had closed a week earlier, he would not have made it. That's not an exaggeration. That's the reality. And it's not just rural hospitals. Urban safety net hospitals, the ones that serve the most vulnerable, are also at risk. The American Hospital Association and other groups are calling these cuts draconian. And honestly, I don't think that's hyperbole. The Senate says they're just trying to restore accountability and focus states on getting value. But as we've seen in previous episodes, like when we talked about the One Big Beautiful Bill, these kinds of cuts don't just trim fat, they cut into bone. And when you cut into bone, people get hurt. Further, Let's listen to the data from KFF on the ramifications of these Medicaid cuts.
Spoke moments ago, as we've been reporting, within the last hour, the GOP-led House passed the contentious budget bill. Here's some of what he just said.
Again, they have been proven wrong. Today, the House has passed generational, truly nation-shaping legislation to reduce spending and permanently lower taxes for families and job creators, secure the border, unleash American energy dominance, restore peace through strength, and make government work more efficiently and effectively for all Americans. House Democrats voted against all of that. So everything that I just said, they voted the opposite. Clearly.
All right. Now, the cuts in this bill could reduce federal Medicaid spending by nearly $700 billion. This is according to analysis from the Congressional Budget Office. Medicaid provides health care to about 72 million Americans, including crucial mental health services. According to KFF, 35% of non-elderly adults who are enrolled in Medicaid have a mental illness. And that includes 10% with a serious mental illness. For more on this, let's bring in Julie Rovner now. She is the chief Washington correspondent of KFF Health News and can provide more detail as to what's in this bill. Julie, good morning to you. It sounds like there the House Speaker is joyful that this has been passed. The healthcare cuts, though, could be wide-reaching. Help us understand what it entails.
Yes, and some of the last-minute changes to this bill made these healthcare cuts even wider-reaching. This is what the conservatives wanted in order to win their vote for the bill, to win those last few handfuls of votes. I'm already getting emails from hospital groups concerned that the Medicaid cuts could require them.
So, who comes out ahead in this bill? Well, if you're wealthy, you're probably smiling. State tax exemption jumps to $15 million per spouse, indexed to inflation and made permanent. There are permanent business tax breaks, and seniors get a bigger deduction, $6,000 if you're low to moderate income. But if you're low income or you rely on Medicaid, it's a different story. Millions could lose coverage, especially with the new work requirements and stricter eligibility checks. And let's not forget the paperwork. Even people who technically qualify might lose benefits just because they can't keep up with the red tape. The Congressional Budget Office says the House version would leave nearly 11 million more people uninsured. The Senate's cuts are even deeper, so the number could be higher. And as we saw in a recent study, these kinds of cuts could lead to thousands of preventable deaths and hundreds of hospital closures, especially in rural areas. And what does the public think? Polls show that nearly 2/3 of Americans view these Medicaid cuts with disdain. Even in rural areas, 3 out of 4 people say Medicaid funding should increase or at least stay the same. So this isn't just a blue state issue, it's a national one. And honestly, I had to ask, are we really okay with people's health and lives for a tax cut? Because that's what's on the table. And as we discussed in our episode on the One Big Beautiful Bill, these are the kinds of trade-offs that shape the future of our country. I'm getting a little fired up, but I can't help it. I see the faces behind these numbers every day, and I just don't buy the argument that this is about waste, fraud, and abuse. It's about priorities, and right now, the priorities are upside down. If this episode made you rethink what a budget cut really means, don't stay silent. Leave a comment. Should Medicaid be tied to work requirements in a post-pandemic world? Share this episode, especially if you live in a rural area or know someone who relies on Medicaid. And hit that subscribe button because we're not done holding power accountable. The story is never just a headline, and healthcare isn't a privilege. It's a right. I'm Dr. 𝐃𝐨𝐧'𝐭, and this is The Real 411. See you next time.